So in this video, we are going to talk about all the possible spinal cord disorders. After this video, you will be able to diagnose most of the spinal cord disorders based on these key points. Starting from the basic anatomy of the spinal cord, you should be thorough with it. Like you must know the dorsal column carries the proprioception and the vibration. The lateral corticospinal fibers are responsible for the motor function. The laterospinothalamic are responsible for the pain and temperature. And you must know that the decussation of the corticospinal takes place at the medulla, whereas the spinothalamic takes place at the level of spinal cord itself. And same for the dorsal column, it takes place above in the spinal cord itself. So coming to the diseases, the first disease, Tabes dorsalis. It is a complication of syphilis known as neurosyphilis. There the posterior columns are damaged, so the patient experiences loss of proprioception and vibration, and Romberg sign is positive. This can be differentiated with the disease SCAD, subacute degeneration of spinal cord due to the deficiency of vitamin B12. In this also the posterior column will be damaged, but along with it there will be also loss of corticospinal tract, so the patient will have both sensory and motor manifestation. So this was about the posterior column. Now coming to second disease, which is syringomyelia, which is asymmetric dilatation of the spinal cord causing pressure on the adjoining tracts. So due to the asymmetric dilatation, the point where the lateral spinothalamic tracts decussate, there it's the first site to cause compression. So the patient experiences loss of pain and temperature. So he complains of painless burn. Later on, it can also involve the motor system. But here, the key finding is cape-like distribution of sensory loss. Now, coming to the next syndrome, which is the Brown-Sequard syndrome, which is due to the hemisection of the spinal cord, resulting in the ipsilateral loss of vibration and proprioception, and contralateral loss of pain and temperature. But at the level of lesion, you will have element type of palsy and flaccid paralysis, and below it you will have the spastic weakness due to the corticospinal tract involvement. And the pain and temperature is 2 segments below. Coming to the next disease, which is the conus medullaris and cauda equina. These are the core typical spinal cord disease. Conus medullaris is a bilateral disease. It presents suddenly. In conus medullaris, the knee jerk is preserved, but the ankle jerk is affected. Whereas in cauda equina, it's gradual, it's unilateral, both ankle and knee jerks are affected. The patient of conus medullaris complains of bladder and bowel issues with sexual impotence, whereas the cauda equina patient usually complains with radicular pain in the leg. So these are the typical core differentiating feature. Whereas in the conus medullaris, you will find symmetric hyperreflexia, whereas in the cauda equina, you will find asymmetric areflexia and paraplegia. So these are all the spinal cord disorders. Apart from this, you have the amyotrophic lateral sclerosis, in which both the human and element is involved. So the patient will have both features of human, like Babinski sign and hyperreflexia. Along with it, the anterior horn cells are damaged. So somewhere he will also have the features of element, like fasciculations and muscular atrophy. And you mark the answer, amyotrophic lateral sclerosis. And the final one, the transverse myelitis. Initially, it will have all the features of spinal shock. Later on, it will develop human-like features. And the final one, the Guillain-Barré syndrome, it's typically a lower motor neuron disease. So this was all about the spinal cord and related syndromes. I hope you like the video. Thank you for watching.